Hello friends, I'm Shaurya Mishra. Welcome back to your own YouTube channel, Vision Care Advisor. Friends, today we will talk about a condition called ectropion, where the eyelid margin turns outward. So, let's know in detail about ectropion. Firstly, let's know what is ectropion. Ectropion is a disease that causes the eyelid margin to turn outward. So, due to turning the lid margin outside, the inner surface of the eyelid is exposed, and due to the exposure, it becomes more sensitive to irritation. If we are talking about the causes, so most common cause of ectropion is old age, mostly 60 years plus. Ectropion is most commonly affected the lower lid. It can be mild or severe. In mild ectropion, the sagging of eyelid is partial, while in severe cases, the sagging of the eyelid is entire length of the eyelid. Now, let's know the sign of the ectropion. So friends, as explained that the lid margin is turned outward in ectropion can be classified in 3 grades that helps to determining the severity of ectropion. So, grade 1, if only punctum is everted and lid margin remains relatively unaffected, that comes in grade 1. Grade 2, if the lid margin is everted and the palpebral conjunctiva becomes visible. And grade 3, if the fornix is visible, it means lid margin and palpebral conjunctiva are everted, and fornix means the deepest part of the conjunctival sac becomes visible. Now, let's know the symptoms of the ectropion. So friends, we can categorize the symptoms in 3 groups. 1. Tearing. 2. Ocular irritation. 3. Cosmetic disturbance. Let's know each symptom one by one. So friends, tearing is also known as epiphora. So, when ectropion occurs at a punctal area, it moves the punctum away from the tear lake and interferes with the normal tear drainage. In ectropion, eyelid can't properly distribute the tear film over the surface of the eye, and due to inadequate spread can lead to discomforting symptoms including chronic irritation, burning, stinging, foreign body sensation, mucus discharge, pain, photophobia, and blurry vision. In addition, the patient may be bothered by cosmetic appearance of the red inflamed thickened lid margin. Now come to know type of ectropion. It can be categorized into 2 main types according to the time of onset. 1. Congenital ectropion, and number 2. Acquired ectropion. So friends, as we know, the conjunctival ectropion is present at birth, while acquired ectropion is develops after birth. So let's know what is congenital ectropion. Congenital ectropion is a rare condition, could be due to inherited rarely and abnormalities during fetal development impacting the eyelid structure. Congenital ectropion may be seen in Down syndrome and blepharophimosis syndrome. It may occur in both the lower and upper lids and is due to developmental vertical or shortening of the anterior lamellar tissue. This developmental issue leads to the eversion of the eyelid margin that contributing to the outward turning of the eyelid. So, what would be the treatment options? Hence, congenital ectropion may resolve on its own without any treatment, especially in mild cases. However, more severe cases may require surgical intervention such as a full thickness skin graft. This procedure is aimed to vertical lengthening the anterior lamellar tissue to address the ectropion and restore normal eyelid function. Come to know the acquired ectropion. Acquired ectropion can be further classified based on its underlying causes or associated conditions. So there are 4 types of acquired ectropion. Number 1, Involutional ectropion. Number 2, Cicatricial ectropion. Number 3, Paralytic ectropion. Number 4, Mechanical ectropion. Now friends, let's know one by one in details Firstly, we will discuss the involutional ectropion. What is evolutional ectropion? So, involutional ectropion affects the lower lid of elderly patients. It results due to age-related changes such as the descent of the midface and most commonly observed in the lower eyelids. The key features include disinsertion of the lid retractors, laxity of the medial and lateral canthal tendons, and atrophy of the orbicularis fibers. The clinical assessment of lid laxity involves evaluating different aspects. Number 1. Horizontal eyelid laxity. So, horizontal eyelid is evaluated by two methods. First, pinch test, and second, snapback test. So, how can we use these two tests? Let's know step by step. First, pinch test. The pinch test is used to check the laxity of the skin on the lower eyelid. So, you have to instruct the patient to look up with an open eye and grabs the skin below the eyelashes with either fingers or smooth forceps. Then, pull the lower lid downwards. Now, measure how far eyelid can be pulled away from the eyeball. A healthy lid will not distract more than 6 mm from the globe, and during pinch test, if you are able to retract more than 7 mm from the globe, it means the lid is lax. यानी कि lid loose है. So friends, now we can do another test along with the pinch test that is called snapback test. So in pinch test, you have to pull the lower lid downward and measure the distance of distraction from the globe, but when you releasing the eyelid, the snapback test is started from here. So how we do the snapback test? Second, snapback test. While releasing the eyelid, you have to observe the speed of returning to its position. In case of eyelid laxity, the behavior of the eyelid varies. Normally, the eyelid quickly returns to its position without blinking. In moderate laxity, the eyelid snaps back into place after a blink. However, in severe laxity, the eyelid may remain away from the eye. So, there are 4 grading in snapback test. As you can see on the screen, here it is grade and here it is standard criteria. When you release the eyelid, it returns back immediately. So, it is normal eyelid. But when it returns back in 2-3 seconds, that is grade 1. When it returns back in 4 to 5 seconds, it will come in grade 2. When it returns back in more than 5 seconds, it comes in grade 3. And if the eyelid does not resume in normal position, that comes in grade number 4. So friends, the snapback test is a technique that can be used to grade the lower lid laxity. It allows to evaluate the tone of the orbicularis oculi muscle. Now friends, next we can perform the distraction test. So, lid distraction test can be used to check the eyelid laxity of both medial and lateral canthal tendon. So let's know one by one. First, medial canthal tendon laxity. In medial canthal tendon laxity test, you have to pull the canthus laterally, यानी कि outward along a horizontal line until no further movement is possible. If you are able to move the puncta 1 mm to 2 mm outward, that is a normal value. But if you can move the puncta more than 2 mm outward, that means the lid is lax. And if the puncta will reach the limbus, that means the lid is very lax, यानी बहुत loose है. But if the puncta will reach the pupil, that indicates the severity of the medial canthal laxity. Now, how to check lateral canthal tendon laxity? Similarly, in lateral canthal tendon laxity test, you have to pull the canthus medially towards the nose along a horizontal line until no further movement is possible. If you are able to move the puncta 1 mm to 2 mm inward, that is a normal value. But if you can move the puncta more than 2 mm inward, that means the lid is lax. And if the puncta will reach the limbus, that means the lid is very lax. But if the puncta will reach the pupil, that indicates the severity of the medial canthal laxity. Now come to the treatment of involutional ectropion. So treatment options for ectropion depends on the predominant laxity component like medial, lateral or generalized. Number 1. If the ectropion is generalized, then it can be treated with horizontal eyelid shortening by excision of full thickness pentagon of the lid. If there is a punctal ectropion, a small diamond tarsoconjunctiva excision can be performed below the inferior punctum. Number 3. When the lower eyelid is turning outward and the puncta is also turned outward, this can happen when the inner part of the eyelid is loose. So, a diamond-shaped piece of tissue can be removed and making the eyelid shorter to fix this problem. This surgical procedure is called the lazy T procedure. Number 4. If the ectropion is severe and more marked over the lateral half of the lower eyelid, then Byron-Smith modification of Cohen-Zimnowski procedure is performed. Now, come to the second part of acquired ectropion, that is cicatricial ectropion. Cicatricial ectropion is when the eyelid turns outward because of the shortening of the anterior lamella of the lid, which is performed by skin and orbicularis muscle. This shortening can happen because of injuries, burns, inflammations, or previous eyelid surgeries. So now, come to the part of treatment of cicatricial ectropion. Friends, in mild cases of lower lid cicatricial ectropion, a simple procedure is performed to tighten the eyelid by Z-plasty may be enough. However, in more severe cases, the excision of the scar with a skin graft to the raw area can be performed, and the skin of the opposite upper eyelid is ideal for this purpose. Now come to the third part of the acquired ectropion, that is paralytic ectropion. In paralytic ectropion, the patient is not able to close their eyes because the paralytic ectropion occurs due to the loss of orbicularis muscle tone, and this can also cause lack of thalamus where the eyelid can't fully close. This loss of muscle tone occurs when there is seventh nerve palsy. And the seventh nerve palsy means the facial nerve is paralyzed, which is responsible for controlling facial muscles. So facial nerve paralysis can result from various causes including trauma, Bell's palsy, or surgery to remove tumors inside the skull, just like acoustic neuroma. So the strength of the orbicularis muscle can be checked by a simple test. Now ask the patient to forcefully close their eyes. In cases of paralytic ectropion, the strength of this muscle is usually reduced compared to the normal side because of the seventh nerve paralysis. Now, come to the treatment of paralytic ectropion. The main goal is to prevent an eye condition that is called exposure keratitis. In mild cases, we use artificial tears, often to keep an eye moist. At night, we may apply antibiotic ointment or use tape to help the eyelid close and protect the eye. For more severe cases, we might do a procedure called tarsorrhapy where we temporarily shorten the opening of the eyelids. Another option is laterally canthoplasty, a cosmetic-friendly procedure in some cases. In some cases, silicone slings can be used to correct the problem. These treatments aim to protect the eye and promote healing. Now, come to the fourth part of the acquired ectropion, that is mechanical ectropion. So, mechanical ectropion happens when there is a big lump on the eyelid that pulls it down because of its weight. So, the mechanical factors such as tumors or masses pulling the eyelid down, this makes the eyelid turn outward. These lumps can be either benign or malignant. Sometimes, if there is a lot of swelling in the eyelid, it can also contribute to this problem. Now, come to the part of the treatment of mechanical ectropion. The solution is usually straightforward. We either remove the lump on the eyelid or treat the specific causes of swelling. By doing this, we can fix the issue and bring the eyelid back to its normal position. I hope this video would be helpful for you. Thanks for watching. Stay tuned for more informative videos.